Precious, and today's hot topic is self-advocacy in adult health care for individuals with disabilities.
Special session today. I have a guest presenter, Precious Feliciano.
Hi everyone, my name is Precious Feliciano. I am an educator, an advocate, and a blogger. So today, I get to teach about self-advocacy and health care for individuals with disabilities, such as myself.
So Precious has been in my practice for, I don't know, how many years now?
Since I was 20 months, so I think 5 years already.
Okay. Precious has a form of spinal muscular atrophy. I have a few patients in my practice with that condition. Precious is going to talk about her experience coming into adulthood as a person with a disability and how she has dealt with that identity. Okay. You can feel free to interrupt at any moment with any questions or observations.
So before we go into self-advocacy, I think we should go back to the disabilities rights movement. So alongside other civil rights movements for women, African American, and the gay and lesbian rights, people with disabilities are also working for their rights. Some of the common problems these movements have fought are discrimination, lack of civil rights, oppression, and segregation. Together, people who are described as disabled have been working towards building dignity, self-determination, shared leadership, and inclusion. People use the idea from other movements to create the disability rights movement. The disabilities rights movement have worked hard to represent all people regardless of disability, gender, sexual orientation, race, economic status, and etc. So disability awareness. I learned this last year, my first year of my master's program for special education, and I thought it was just like mind blowing, right? So when I first learned about it, I was like, okay. So they said we must be aware that our disability does not define us. So it doesn't matter if you have a learning disability, a physical limitation, emotional difficulties, hearing or vision loss, autism, or intellectual disability. It doesn't matter. Once you know and accept that your disability, or once I know and accept that my disability as a description of how I learn and function does not determine of how you are, of how I am, and then everything else, such as self-advocating for what is needed, becomes a whole lot easier. So once I learned that, I was like, hey, okay, that's it. I'm gonna self-advocate for myself. No more my mom. No more being afraid of it because my disability does not define me. It is just, I call it my accessory. Or thank you.
So, as I said, I've been really privileged to share this journey with Precious. And I think it's a very special role that family physicians can play in transitioning adolescents with chronic conditions into young adulthood. The concept of patient-centered medical home, as many of you may know, did come from pediatrics initially and was created in order to support families and children with multiple disabilities who require special equipment at home, multiple specialists, and coordination of care. We're trying to do that in adult medicine, struggling to do that a bit, but hopefully we'll move in that direction. So the challenges in working with young people with chronic conditions as they transition from pediatric settings where there is much more attention to this interdisciplinary care world is that in adult medicine, setting up all the specialty clinics is very different. We had major challenges in trying to set those up, and many of the adult specialists were not familiar with the equipment that some of the pediatric folks used, and that was a challenge as well. and certainly the issue of getting integrated mental health care and social services that are often needed, transportation and supplies, can be a challenge.
So issues in transitioning. So it says patient and family may need to try out options such as needed clinicians of who are comfortable with home care, equipment, emails, and phone management, can build shifting roles in parents and patient autonomy, can support reproductive health and sexuality, and can balance limited life expectancy, vulnerability with potential for growth. So after I went over the last bullet of can balance limit life expectancy and vulnerability with potential for growth, I had to break it down for myself so I can explain it to you guys further. So to me, I think that means just because a person with a disability, such as myself, who has spinal muscular atrophy, may have a progressive disease, that does not mean that doctors should stop treating. That doctors should continue to treat as they would treat a person who does not have a disability. Just stop treating.
Yeah, I must say that one of the challenges for me often in the patients I've had is to talk with their parents and with them about end-of-life decisions from the beginning, because clearly their vulnerabilities to things going wrong and illnesses progressing much more rapidly in more healthy young people is always a reality, and so put that on the table right away. At the same time, though, I think to honor and support, Precious has been really quite determined to be successful in school and has been quite successful as she's laid out for you. And to keep those two tensions alive and shifting between them all the time, I think has been really important. Yeah. And has been a lesson that I've learned in my caring for patients with this condition. So, you want to talk a little bit about self-advocacy.
So how does self-advocacy fit into all of this? Well, self-advocacy is an important movement and is a key element of the disabilities rights movement, and is an important skill for many people to learn to be successful, especially when it comes to our medical decisions. So I hope you all loved the video. The workshop was great. If you have any questions on self-advocacy in the adult healthcare and higher education, so you can simply just send me an email and I'll send you a PowerPoint of both self-advocacy in higher education and in adult healthcare. Until next time, guys.